In this presentation, we will have a closer look at the importation of foods of animal origin into South Africa and the implications thereof on public health. The safety of food that is of animal origin has a big impact on food security and is a responsibility shared by many stakeholders with a complex interconnectivity between the regulatory departments in South Africa. In the end, it all comes down to this: good or safe food means healthy people and a healthy environment. In this diagram, the interconnectivity between the regulatory departments in the South African food control system can be appreciated. The Department of Agriculture, Land Reform and Rural Development, the Department of Health, and the Agency for Department of Trade and Industry are major role players. The control over foodstuffs is regulated at a national, provincial, and local level, as well as several other organizations. In terms of the Animal Diseases Act and the Meat Safety Act, all South African citizens may import animals or animal products which are considered to be safe into South Africa. They must apply for a veterinary import permit from the Director of Animal Health, and this permit needs to be obtained before the animal or animal products is exported from the country of origin. The health requirements change often, and it is therefore necessary to contact the Import-Export Policy Unit of the Directorate of Animal Health to obtain the latest requirements. Animal products or animal-derived products include milk, cheese, meat, biltong, skin, furs, game trophies, animal feeds containing animal materials, vaccines, and medication made from animal material, and lab samples of animals. When importing into or moving in transit processed meat products, as mentioned before, you need to apply for a veterinary import permit or an in-transit permit from the Director of Animal Health. The import permit, however, is only valid for a limited period and only for one consignment. Imports via third countries are generally not accepted. The Director of Animal Health will only issue a veterinary import permit or in-transit permit for processed meat products from countries where the vet services and animal health status have been evaluated and approved. The import protocols are country-specific based on the product and animal health situation there. Meat products in completely airtight sealed containers must also get approval from the South African Bureau of Standards.
Import requirements and illegal importation. Requirements of imports are aimed at preventing the introduction of exotic or foreign diseases into South Africa, to protect the national animal and human population, as well as our export markets. And meat is also controlled by the Directorate Veterinary Services, which will evaluate the slaughtering procedures and abattoirs of the exporting country. Illegal importation includes any consignment imported into South Africa without the original vet import permit. This just highlights the importance of a vet permit. Consequences of illegal importation include refusal of entry and detainment of the consignment, or an order served to the importer to remove consignment from South Africa, or it will be destroyed, or even prosecution of the importer.
With regards to imported foodstuffs, there are two acts which are the most relevant. The National Health Act of 2003, which states monitoring of imported foodstuffs is the responsibility of the Port Health Services, and the other act, which is the Foodstuff, Cosmetics and Disinfectants Act, which states control of imported foodstuffs is delegated to National Director of Food Control. Public health. Public health is the science of protecting and improving the health of people and their communities. Its role is to promote the welfare of entire populations, ensure their security, and protect them from the spread of infectious diseases and environmental hazards. It also helps to ensure access to safe and quality care to benefit the population. 4 important key patterns involved are health as an individual asset, health as a lifestyle, health as a focus of the healthcare system, and health in the context of social support. With regards to the implications for public health, there are stringent importation laws and regulations required to protect the consumers of the importing country. Failure of these measures may lead to introduction of eradicated or novel disease pathogens, which will have major economical and health implications for the importing country. An example is no importation of raw pork or meat from wild pigs for own consumption is allowed. This is important for the control of diseases like classical swine fever. Classical swine fever is currently not present in South Africa. This is due to strict import regulations in place to prevent entry of this pathogen. The South African pig population is naive, and introduction of the disease will be devastating. Classical swine fever survives for long periods in raw pork. An example of a classical swine fever outbreak in South Africa occurred in 2006, where imported pork from a country of origin that could not be traced went bad due to a break in the cold chain, and the pork was fed to pigs in the Western Cape. The infection of the pigs that were then culled and donated to a needy community resulted in further disease transmission. Ultimately, this led to the culling of between 18,000 and 26,000 pigs in Eastern Cape, with the province's largest pork producer losing pig units in Allowal North and Cook House. This cost the company an estimated 65 million rand in income. Culling of pigs was likely to increase reliance on pork imports to meet the demand in SA, as SA was a net importer of pork at the time.
Implications for public health. We also need to consider the quality of meat and animal products being imported and exported. Meat inspection at abattoirs is a critical step in ensuring that there is no transmission of parasites, bacteria, viruses, and fungi. We need to ensure that abattoirs follow a well-managed hygiene protocol. This will prevent meat contamination with bacteria like Salmonella and Clostridium. Abattoir workers need to be trained correctly, and all meat being imported should be checked by the exporting veterinarian prior to export. The chain of custody of all products should be thoroughly followed to ensure we are not allowing any diseases to enter the country. Other products with public health implications include products like milk or cheese. Zoonotic diseases like brucellosis, caused by Brucella abortus and Brucella melitensis, have been found before in raw dairy and meat products. In the past, dairy products like cheese has traveled across borders and infected people in various countries. It can be a major cause of disease in humans and animals consuming these infected products. It is therefore vital that stringent policies are set in place in South Africa to prevent the entry of any products infected with such diseases. Imported meat can be monitored through microbiology. There is a procedural manual which officials can follow during sampling and microbiological testing of imported raw meat to ensure compliance with import requirements. Imported commodities such as trimmings, anatomically unrecognizable parts, mechanically recovered meat, and carcasses of all species may be subjected to bacteriological testing prior to release. The sampling frequency may be increased or decreased based on the results of previous microbiological analysis.
Thank you for your time and attention.